House Appropriations Subcommittee on Human Services will come to order. Clerk, will you please take the attendance?
Chair Roth.
Here.
Representative Kelly.
Here.
Representative Mueller. Representative Beeson.
Here.
Representative DeSanta.
Here.
Representative Edwards.
Here.
Representative Longjohn.
Here.
Mr. Chair, you have a quorum.
Thank you, Madam Clerk. We appreciate it. Today we are going, we do have to get a minute, sorry. I'm going to get back in the thing here. Yep. Representative Tim Kelly will move to approve the minutes of March 25th meeting. If there's no objections, the minutes are approved. Thank you, sir. Today we're going to have a presentation on from Dwayne Hayward, and Senior Deputy Director of Economic Stability Administration of DHHS. Sir, we'd love to hear from you, and when you're ready, go ahead.
Thank you, Mr. Chair. Good afternoon, everyone. My name is Dwayne Hayward. I'm the Senior Deputy Director for the Economic Stability Administration within the Department of Health and Human Services. Today, I'm going to just present some programs that we administer. I'm also going to give you initiative, the diaper initiative, and then I will wrap up with the weatherization program. I always like to, I want to make sure I keep getting this go. All right, I want to advance, and it's not advancing.
Excuse me.
Oh,
Sorry. Oh, you might just have to click the.
Which one? The top one?
Yep.
Okay, there we go. Okay, sorry, was going through a very good presentation, and so I always like to start with health, safety, and prosperity, which is embedded in our mission statement. And one of the things that we want to make sure that I convey today is that we cover 83 counties with 100 offices. We have 3,000 dedicated specialists, and we process over 3 million registrations in a program year. Now that's the front end. We also have the follow-up to the 3 million registrations. I want to just start to highlight the various programs, and I have them highlighted, and I'll start with the Supplemental Nutrition Assistance Program, which is known as SNAP, Food Assistance, Medicaid, Child Daycare, CDC, State Emergency Relief, SER, the Family Independent Program, and also State Disability Assistance. Now I'll drill down, and as you can see, I wanted to add the program eligibility. Again, to the right, must be a Michigan resident, head of household, must verify the identity, must meet the program asset limits, must meet the program income limit, and must be a federally approved lawful present individual. For the state of Michigan, we actually administer and oversee 1.3 average monthly SNAP recipients for an average benefit of $250, benefits issued each month. According to the United States Department of Agriculture, for every dollar that's invested with the SNAP, $1.65 is invested in the local economic activity, which is excellent. A continuation of our FAP is the Summer Electronic Benefit Transfer. In 2024, $120 million in benefits was issued to over 1 million children. Now, you probably ask, what are the eligibilities? I have them outlined. 0 to 6 years, you must be enrolled in a school program, meet the financial criteria, in foster care, experience homelessness, a migrant, or runaway. The second part of the eligibility is 6 to 18 years. There, you must be receiving SNAP, the temporary assistance for DD, TANF, or Medicaid, and approved for free or reduced price meals. In foster care is experiencing homeless, a migrant, or a runaway. And as you can see, the eligibility, if you've already been qualified for SNAP, TANF, normally the benefits are automatic, and the federal guidelines allow us to use the benefits up until 122 days. Again, federal requirement. So I'll go into the Medicaid, and as you can see over, I do have the eligibility, must be a Michigan resident, not required to verify identity. However, MDHHS has multiple ways to verify the identity of applicants. You must meet the asset limit, must meet the program income limit, and must be federally approved lawful present individual. The Medicaid program, the background. Medicaid is the largest insurance program in the U.S. It's means tested. It is a comprehensive health care coverage for eligible populations, including low-income children, elderly and disabled individuals, and pregnant women. Medicaid covers 1 in 5 individuals in the U.S. and Michigan. The coverage rate is even higher, in the United States, but it is higher in Michigan, 1 in 4 Michigan residents. The Michigan Medicaid program affords coverage to over 2.6 million Michigan residents, each including 1 million children, 300,000 people living with disabilities, 168,000 seniors, and provide nearly 725 adults in the Healthy Michigan Plan. Also, 45% of the births in Michigan are covered by Medicare. Next, we have the child daycare. And I need to level set for child daycare, the department actually determines eligibility. The funding is actually controlled and the policy by my lead. So just wanted to level set to make sure you understand. And of course, I do have the eligibilities. With that said, 42,000 average monthly eligible cases, and out of the 42,000, 39,000 children are subsidized on an average monthly stipend. Now I will move to the state emergency relief, and here we have 2 tiers. I'm going to talk a little bit about the first tier, and that is energy. So we have energy, and with the energy, we have about 16,000, a little over 16,000 average SER applications. The SER funds run from November until the funds are exhausted, and we expect the funds to exhaust sometime in August, maybe a little later. We average about 1.7 million each week in SER payments. And for the SER energy, you can see to the right, it covers electricity, deliverable fuel, energy-related SER, and heat. The second tier of the SERs is non-energy related, and that covers water, home repairs, home ownership, burial, rent to prevent eviction, and rent to relocate. And a continuation of that is the homeless prevention, a part of the SER, and that provides security deposits, first month's rent, moving expenses, and rent arrearage. Next, we have the Family Independent Program, and of course, again, I've just added the eligibility requirements. A big part of our FIP program is the average 27 monthly recipients that we actually oversee. Out of the 27,000, 21,000 FIP recipients are children. A big part of that is the clothing allowance supplemental payment. In 2024, 10 million, and we served about a little less than 20,000 that received the clothing allowance. The state disability assistance, again, the eligibility, we average about 2,000 recipients per month with an average dollar amount of $213. And that completes the first tier of the programs, and so I wanted to just talk a little bit about the diaper program, so I'm making the transition, and then I'll end with the weatherization program. The diaper bank and the weatherization program. So in 2024, we had a funding of $4.4 million. We served over 10,000 households. With that 10,000, we delivered over 74,000 diaper packs and over 40,000 wipes. Fortunately, in 2024, we had an increase to $6.4 million. And I'm going to give you from October to March because we're not finished yet. And so as we sit here today, we've served 4,500 households and thus far 20,000 packs of diapers and 13,000 packs of wipes. So really significant and really helped the families. The last program, as I close and finalize the presentation, to talk a little bit about the weatherization program, a 40-year entity that's been with Michigan. In order for our entities, we have to identify the folks who will be operating our weatherization, and we have 23 community action agencies, and they cover all 83 counties. To meet the eligibility for our clients, of course, 200% of the federal poverty guideline. The formula and the funding is pretty much coming out of the Department of Energy, the Low-Income Home Energy Assistance Program, the Federal Recovery Fund, and at times the General Fund. We average 1,700 dwellings each program year, but with the additional funds, our target is going to be 3,000 dwellings up to this program year. A little history, 40 years. We have weatherized at least 29,000 dwellings. The nice thing about the additional funds, the home stabilization, as you know, some of the homes are not in the greatest shape. And so in order to get them to a level of a shape that you can actually weatherize, the Home Stabilization Fund has allowed us to do that. So bringing those homes up to some level of repair, and then you can weatherize. For Michigan, the industry experts, weatherization requires certification. It's a high-level energy-efficient knowledge, and so we set a high standard for our weatherization program here in the state of Michigan. Along those same lines, the workforce. Michigan is building the pathway to a meaningful construction trade career that offers meaningful, sustainable wages. And the two-year funding, I'll just give you the total for FY24 and 25, a total of $74 million. And of that $74 million, that's ready for weatherization, 274. And the houses weatherized already, 943. Again, with the additional funds, our target is 3,000 homes. With that said, I will yield the floor for questions, and I want to thank you for the opportunity to come before the House Subcommittee.
Thank you very much for the presentation. I do have a few questions. Let me start with home stabilization. Is that referred to as pre-weatherization? Is that the same line item, or are we talking about two different line items?
I'll have to get back with you. I have Paula here with me, but just to make sure, but yeah.
She's kind of nodding, so I'm hoping that
Yes.
she says yes. Or there are two? Okay, there's two line items. Thank you. I wanted that clarification. Representative Kelly.
Thank you, Mr. Chair. Could you have an average cost of what it might for the houses to make ready for weatherization?
Again, I don't have that number, but again,
Okay.
I do have the weatherization person with me today. We could get that information back to you.
Okay.
Would that be okay?
All right. Yeah, no, I just remember, and I'm in the Saginaw area, and I remember in the Obama administration when they were doing this, that in Saginaw, we were weatherizing homes that cost more than the price of the home. And I suspect that's going on again, which seems to be ludicrous to me, that we would spend good money after bad. But nonetheless,
We'll get that information
okay,
to you.
appreciate it. Thank you.
No, nobody else? Any other questions? Representative Longjohn, go ahead.
Thank you, Chair. Thank you for your presentation. I'm curious, you shared that for every dollar spent in SNAP, there was a $1.65 economic impact. What about the health impacts? Healthy people, people who are hungry don't live their healthiest lives, and we know that Medicaid recipients, for example, who might have diabetes or other food-related illnesses, need healthy food to live healthy lives. How can you tell us what the kind of effect is of SNAP on the Medicaid program, or on what's the return on investment in healthcare dollars from the SNAP program?
So I can, as opposed to just guessing, I certainly can gather those numbers for you. But I do know that there are programs that we are gearing towards a healthy environment, healthy society. And so it's a part of the education piece of the SNAP. And we think that goes right to your question. But I can certainly give you a detailed response from that. But I can tell you that we are as a part of education, that is healthy eating, in what ways that we can actually lower the healthcare costs.
Thank you, sir. If I could ask my question maybe a different way.
Okay.
I know that, I think we've all seen in the news recently, there were $4 million worth of food assistance cuts from the federal budget that left, people waiting in line, wondering if the food was going to show up. Many of those folks might be Medicaid recipients. If we cut the food assistance program, what plans does Medicaid need to make essentially to cover those costs that are going to accrue as folks show up more sick and with less health? Is that something that as a department you guys are forecasting given these cuts to food assistance?
And I would answer that short, basically saying that our health department, working with all of our divisions, will strategize on how we actually make a meaningful impact. I will be able to, I hate to keep saying I'll take it back, but I want to make sure I give you the correct answers, the complete answers that you're asking. But I will tell you that our health department is really looking at all of the strategies, and then we will come in with our programs and see what is best and compare that to the federal, if there are meaningful cuts.
Thanks.
And how it will impact.
Representative Beeson.
Thank you for being here today, and thanks, Chair, for a quick question. Your SNAP benefits, and I used to carry a lot of this at my business and EBT and SNAPs, and my question is I'm noticing that there's a few states that are still carrying the RMP, which is the SNAP benefits for fast food restaurants. We're one of the states. It's us, Arizona, California, Maryland, Massachusetts, Rhode Island, New York. Are we going to get away from that now that COVID's over and people can start doing themselves, or are we going to continue to use SNAP benefits at these places?
Now, you're talking about the restaurants for seniors, disabled, and elderly?
Is that all the RMP is, just for those
Yes.
for 3 areas?
3 areas.
And that's it. So that's all they're allowed to use.
That's correct.
But they're still allowed to use it for, it looks like DoorDash and everything. They just have to pay for the cost to get it there, but they can still use it with delivery then.
That's correct. And we're talking about elderly,
Correct.
disabled, and veterans.
Yes.
Yes.
J-
And we plan to continue at least until the foreseeable future. We don't know what the federal guidelines will come down, but as far as what we have now is the waiver that allows us to continue.
Okay. Thank you. Homeless too.
Yes. So thank you.
Thank you, Representative Beeson. One that I had was in the diaper assistance program. We're looking through that closely. We don't think it's a bad program. That's not the point. How much administrative costs are associated with that? Do we have any idea?
So again, I will defer to the diaper administrator and just get the.
If we can get that back, that would
Okay.
be grateful help. I'd be more helpful with that, yeah. I know we're getting a little more technically sound on the online services. Can I apply for SNAP benefits online?
Absolutely.
Yeah, I assume that. What kind of security mechanism, I don't know if I'm saying it the right way, but make sure that if I go online and say, I make $25,000, oh, you don't qualify for SNAP, oh, now I make $15,000. Is there a fraud mechanism online that's going to catch some of that or deter some of that activity?
Well, one of the things that we do is we do the cross-check, and we cross-check it with the Social Security, and it's part of the My Bridges system. Our workers will get a check and basically know that it's been checked, and if it's unchecked, then you actually will dig a little deeper. But the answer to the question is we will get the verification, number one, and we compare it with the check stubs. We're gonna require
Awesome,
some
yeah.
verification.
Good. Yeah, I appreciate that. Good. Any other questions? No? Okay. Well, we appreciate your time today, sir. Thank you for coming and testifying, and we're going to give the committee a little bit of a break today and let them move on to their next assignments, and we really appreciate it. And there be no further business. The meeting is adjourned.
Okay, thank you.
Thank you. I did it today.
You did it.